Hi, I'm Alistair at Lazarus Training, and in this video I'm going to give you an update on how we can still do CPR, but showing you the updates that are brought in because of the coronavirus COVID-19. So on our first aid courses, we're often asked, how do we update our cardiopulmonary resuscitation, commonly called CPR, to allow for the fact that the patient might have COVID-19? Now, the reason for this update video now, today, is that recently the International Liaison Committee on Resuscitation, the European Resuscitation Council, and for us, the United Kingdom Resuscitation Council, have issued updated guidelines. And the good news is that things are pretty much as they were. The updated CPR guidelines focus mainly on the detail of CPR itself, about early recognition of someone being in cardiac arrest, about an early call for an ambulance, about good quality rapid CPR started as soon as possible, and the early arrival and use of a defibrillator, often called an AED, automated external defibrillator. So the changes that are in, when we talk about coronavirus COVID-19, are that we recommend that you as the rescuer do not put your face close to the patient's face. For example, when checking for breathing, focus on movement in the chest and abdomen instead. We also recommend that you carry out compression-only CPR, and that's what's covered in this linked video. There's also recommendations that if you're able to do so, you place something over the patient's face, a cloth, a face shield, something like that. The purpose behind this is that when you're pumping on the chest, it's possible that droplets might come out of the patient's mouth. And the idea of this thing that you've placed over the face is to act as a barrier method of protection to stop those getting airborne. Now, I'm describing it to you now, but it's probably better you watch the video. So linked up here is the video that we made recently, and the good news is that the information in that is all still correct. So I hope this video has been useful to give you an update on how we can do CPR with allowance for COVID-19. We've got more video content coming out all the time. If you've liked the video, please like it. If you haven't liked it, let us know why, and we're always looking to improve. We've got more content coming, so I'd recommend subscribing to the channel. Crazily, 90% of the people that watch our content aren't subscribed, and there's always the potential they'll miss out on our next video. The next one being about how we can stop someone bleeding from their leg using a water bottle. You don't want to miss that. So subscribe, like, whatever you want to do, share the content if you can. And if you have any questions, queries or concerns, just stick them in the comments down below and someone in the team will be back to you as soon as we can. So for now, take care, and I look forward to seeing you in the next one.